Hello. Today is the day before my 4th chemo infusion, and the schedule's a little different this week. We just got done a little bit ago with my virtual appointment with my oncologist, and usually we do it tomorrow, like right before infusion. But since we did it this way, it's gonna help with like spending less time at the hospital tomorrow. So tomorrow should be a lot, like it should knock off a couple hours, or like an hour and a half of like waiting in the doctor office and talking to the doctor. And we took care of that today. And so it's gonna be like that for the next 2 times, and then I'll see her the last time. But yeah, today's the day before my next chemo infusion. And this morning I was pretty like anxious about it and just kind of like grumpy a little bit. And now I feel a lot better. I think just after talking to the doctor and kind of like getting my mind ready and everything for this week just makes me, I don't know, I feel a little better already than I did this morning. But it's been kind of a funky last couple of weeks, nothing crazy. I did end up going in for hydration the Monday after my last chemo. We didn't have an appointment, but I did need it pretty bad by like Sunday, and then they don't really do appointments unless it's an emergency on Sunday, and so waited till Monday and got an appointment, and it kind of took up my whole day. I did record something quick about it from last Monday. I didn't post it. Maybe I'll like add it into this video or something. But and so just to be proactive, talking to the doctor today, we did schedule hydration. We actually scheduled 2, and like most likely I'll need 1 or none. But we scheduled one for Saturday and then one for Monday. And so if I feel at all like dehydrated by Saturday, I'll go then. And if I can make it through the weekend, I'll go on Monday. If I need both, which I hope I don't, we'll do both. I hope I don't need any. Just this last time, it was just really hard just to get water down. Water, like the taste and everything was just really difficult. But like when I didn't even have like digestion problems when I needed hydration this last time yet. The digestion problems came after, but I didn't get dehydrated from that. I really just got dehydrated from like not being able to drink enough water for a couple days, and then not being able to catch up. And so we're gonna be again proactive this time and schedule it out. Great conversation with her. We looked at my blood results, like tests from the last couple of weeks, and everything looks normal. She said like my white blood cell count is up. That's normal because of like the medication I'm getting, and then my glucose numbers are up. That's because of steroids. And then my liver was like 2 points out of the normal range, but that's because of chemotherapy, and she's like okay with all that. And like right now nothing is like out of whack like they wouldn't expect. So I did like learn something a little interesting with some of my symptoms. So like Paul and I were talking this last time, and one of the worst symptoms that kind of is like, I talk about how Thursday and Friday are so bad. And one of it is like this weird like cloud over me, and like it's just so funky. I just don't feel like myself. I'm like tired and dealing with all this other stuff too, but then also like the only way to describe it is almost like a depression. Like I look in the mirror, I don't feel like myself. I look at my kids, they don't look like them. That's the weirdest thing, and I've never experienced anything like this before, and it's just really, really hard to cope. And then I have mentioned before, then it's kind of like throughout the weekend, it's like I wake up and then all of a sudden like this cloud is lifted and like I feel like more normal. So I explained that to the doctor and wanted to know, if it was normal and what it could be causing it. I mean, obviously it's chemo related. And she said that it is steroid withdrawals, and it's like super common. And Paul said I have roid rage or something. And it's because like I'm like starting today, I started taking my first steroids. I take like 14 milligrams in the morning, 14 in the evening, and then for 3 days. And then also tomorrow they'll pump me with more steroids in my IV. And so she said usually like 3 or 4 days out, Thursday, Friday is when, your body is having like withdrawal symptoms. And so it's normal. And so I don't know, maybe that will help this time, just kind of knowing what's going on. It's still not fun, but it's just like really interesting that also like the steroids, they just cause a lot of problems of things in general, but they're helping and they're, helpful. And So that was interesting. Also this last week, you know, this was, I think last Wednesday or Thursday, kids were in bed. I had some lunch really late, like at 3 o'clock. And then like 20 minutes later, I had one of the worst pains I felt. I don't want to like relate to childbirth because with anything like that, but like a really awful pain in my upper stomach. And I didn't know what was going on. And then the pain was so bad, it was like radiating in my shoulders and then my neck muscles, like both of them. And then eventually like my arms. And I let it go on for 20 minutes and I was kind of like buckled over on the couch, like on my knees, like I'm like laying on the couch in like so much pain and like couldn't really do anything. And before I like text Paul, he was working, and was like, I need you. And then he came up and he was worried. And we seriously were like, we called his parents and we're like, just in case we have to go to the hospital, because I was getting ready to call a doctor, can you come over and watch the girls and take care of them for a while? And like, I was like seriously like prepping my mind to like spend the night in the hospital. I really thought it was a like gallbladder attack. So I called the line, explained everything. Then the doctor called me back, and then she talked to my oncologist, and then they got back with me and they said it was heartburn. I've had what I thought was heartburn in the past, especially with being pregnant. Like I would get like some heartburn, but this was like the worst heartburn. I don't know. I still don't even believe it's heartburn, but that's what they said that I've ever had in my life. So it took an hour of being like in that much pain, and then it started to get a little better. And then by 4 hours it was gone. And by 4 hours I was in bed like for like the night. And I felt pretty normal. Then I woke up feeling normal. And so I'm taking Pepcid, which is like over the counter. Over the counter is what you buy at the pharmacy, right? Like from CVS, I don't know. But I'm taking that as like every day to kind of help. But it was just so weird because I didn't have anything leading up, like no heartburn or indigestion for like more than a week. And then all of a sudden I get this like awful attack, and then I haven't had it since at all. So anyway, she told me, it's not gonna hurt to take this Pepcid like for heartburn every day. So I'm just gonna kind of add that. And she said that with the chemo, it like really messes up like your, I don't know, everything. It just messes everything up, and it was probably heartburn. And so it was awful. I don't want to have that again. And it was like, like 2.5 weeks out from my chemo. It was just really interesting. It was just so awful. But I did not have to go to the hospital or anything. Like just the phone call was perfectly fine. Yeah, so tomorrow morning, 7 a.m. blood draw, 7:30 infusion. I feel like I'll be home by 12:30. Like, I really do think that, which would be nice. And then actually at 2 o'clock, we'll be home by then for sure. We have a virtual appointment with a dietitian. And I'm gonna just like start getting some information and things ready for the future with my diet. So, this shirt, I was gonna put the shirt at the beginning, but my friend Aubrey, thank you Aubrey, got this shirt for me. It says heal cancer, and it says like he heals, and then it has Luke 1:13, with God nothing will be impossible. Super cute. Yeah, so I just wanted to make this quick video. I'm probably gonna add this to like the beginning of my chemo number 4 side effects and everything. Getting close to being done. We did talk about with my doctor, the next 2 infusions, and then my surgery date, which will most likely be the last week in July, so I can go on vacation the week before, like a little weekend thing. Which last week in July is my birthday week, but that's fine. And then we even talked about like my shots, and I'm gonna be getting the rest of the year, like where they're gonna be, like location wise. I might be going to West Ann Arbor. And yeah, so that's an update. It's Monday. Not looking forward to the rest of the week, but it's gonna happen. Hello, little update on my infusion today. I'll try to make it kind of quick. A little shorter day today. Got up at like 4:30, was out of the house by 6, and dropped the girls off at the hospital by 7, and had my blood draw, and then my infusion was supposed to be 7:30, but actually ended up being closer to 9 when I actually got in. They had to wait for my blood results before they could like do anything, and then there were some concerns with some of my liver enzymes and another liver function test. And like, we knew they were slightly, like they were like 3 points high last time, but this time they're like 3 times as high. So like, instead of in the 35 range, they're in like the 170 range. But because a third thing looked okay or something, like I was able to still get my chemo today. But it is something they're going to be monitoring and talking to me about. And it's, I think I mentioned or did a little information about like a heartburn, or I kind of thought it was a gallbladder attack, and this also could be related to that. And then they're just going to kind of monitor that, and it's all chemo related. But I was able to get in. I was at the Rogel Cancer Center where I've had 2 other infusions, not at Mott's today, and I had the same nurse I've had for 3 of my 4 sessions, and she's great. Her name's Megan, and she is the only one who's able to get me like my IV in on like the first try, like every time the first try, and the other nurses, like I got poked 4 times, you know, and so really thankful for that. So I was there, I got in around 9, and then I was done by a little before noon. Pretty simple. Got my armband, got my shot in my leg, and then got my 2 chemo and all my pre-meds today. Feel fine. I came home, I ate, then we had Paul and I ran a few errands, like went to Meijer in the post office, and then came home again, and I took a nap. He went back, he did some work, and then he went and picked the girls up, and we just had dinner. So doing good. I feel pretty good today. Again, just a little tired. I'm drinking I can tolerate water today, so I'm drinking as much water as I can. And oh, another thing we did when we came home after lunch is we had a virtual visit with a dietitian, and that seriously was like the best thing for me. Today our goal was just to focus on like eating habits and like just to get me through chemo, to like minimize side effects and be able to like maintain and like get through the rest of my treatment so that we don't have to like change anything, so you know. And I might share a lot more with that later, but it was wonderful. It was a dietitian through U of M. It was an oncology dietitian, and I've never met the dietitian before, and I just had a lot of questions about, there's just so much information out there, and it's so confusing and contradicting at times, and just overwhelming, and I just don't know where to start, or I'll start and like just, you know, you can get lost on the internet, because that's where I was going. And so just talking with a professional about it was really helpful. And so we talked about specific things to help me get through like the next 3 days when my appetite dips and my mouth, everything tastes gross, and you know, we talked about eating smaller meals and like fiber right now, but then in like 3 days I don't need any fiber because I have other stomach problems. And talked about, you know, it doesn't just have to be water. I could drink milk, I could drink Gatorade, I could drink like watered down juice, you know, any kind of liquid, popsicles, anything to get liquid inside of me. And people do best if they maintain their weight during chemo. And actually I need about 300 more calories a day than like your average person. And so it's also kind of funky because I'm only 3 months postpartum, and I'm like 10 pounds from my pre-pregnancy weight, but maybe even a little more of like where I would like want to be. And so, but now is not the time to like diet like crazy. And so that's important. I have lost 10 pounds just starting chemo, but a lot of that, you know, could be just related to like losing some of my baby weight. So it's kind of like a little tricky thing, but I need like 80 to 90 grams of protein a day. And then she gave me all this great information. And the next time we're gonna meet, if I have any questions, I can contact her. But the next time we're gonna meet is before radiation, because there'll be like a little bit of diet changes for radiation. And then we're also gonna meet another time before I start my hormone medications, because there's like a lot that can go, like, you know, I'm like blocking all these like things by taking this medication, and like my, you know, we're talking about eating healthy and stuff. But right now our goal is just to get through the rest of chemo, minimizing side effects so I can like get through treatment the best way possible. And it was very, very helpful and really empowering. So super glad I met with her at we did a virtual appointment, but like through U of M. Yeah, so I'm gonna do a little laundry now, fold some laundry in here, and then I'm gonna help get the girls down to bed. But that was today. It was good. 4 of 6 chemo down. Quick Wednesday update. Feeling okay today, tired. That's about it right now. things are just now starting to taste weird. Starting to lose my appetite and have a hard time drinking water. Like just this afternoon, but I tried to drink as much as I could this morning. Chilling with little Miss Abigail today. Say hi, baby. She's so sweet. She looks like her daddy, I think. Yeah, Charlie is at her grandma and grandpa's house. And just trying to relax today and take it super easy. Right? Gonna go put this girl down for another nap. All right, thanks for everyone's prayers. Okay, so it is Friday afternoon, about 4:30. Paul just left to pick Charlotte up. I didn't record yesterday. Yesterday, Abby did go to hang out with her grandparents for the day, and that was really good for me because Thursday and Friday generally are really bad, and it's bad. And so I kind of yesterday was able to just lay on the couch all day, take a nap when I needed to, and Paul didn't have to worry about helping out, too much, and just kind of chill. It was nice. And we brought Abby back last night, and Charlotte spent the night at her grandparents. And last night we lost power at like 3 in the morning or something. So Paul was up fixing that, lost it for a couple hours, and he was got the generator going and worried about the sump pumps and things. But everything was fine. It came back on, and today just had Abby still just feeling really off, like normal. Tried to take a nap today. I slept for a little bit, but then I just don't feel good, and it's hard to sleep. I'm trying my best to eat and drink. Right now I got, a waffle with peanut butter, because it sounds good, and some cranberry juice and some waters, and trying my best to get a lot of water in. Yesterday was really hard to drink, but today I'm doing a lot better. I'm gonna get dehydrated again. But yeah, overall just feel really off and down and can't concentrate, and my teeth hurt, which is weird, and it's just kind of like it's hard to sleep when your teeth hurt. It's like, you ever get your teeth like when you're really cold outside? That's kind of like what my whole mouth feels like right now. I guess that's how to explain it, like really cold, but it's not cold. I don't know. I'm so looking forward to tomorrow because I'm praying that I feel better tomorrow. I just want to get out of this haze and just whatever is going on. I just want it to be over. But yep, that's how I'm feeling today, and I think that's everything. Yeah. All right, so it is Saturday, middle of the night, like almost 1 o'clock, and I feel really good. I'm so thankful. I went to bed not feeling good at all. Actually, I had to have Paul come help me with Abby. He got Charlotte down, and I was gonna get Abby down, and I just couldn't. I was feeling really nauseous and just not good. So he took over with her, and I came to the bedroom and ended up getting like nauseous and sick and throwing up, which is only like my second time doing that this whole deal. But then I did feel much better, and then I just went to bed. I went straight to bed. And now it's about midnight, and I just woke up and hungry because, I didn't really have lunch yesterday, and then I threw up my dinner, and so I needed to eat some food, which is good that I'm like feeling hungry. And so I just made some cereal and banana and woke Paul up and visited him for a minute because I feel good. Yeah, I'm just so thankful that I feel all right. It's just so crazy how it could just be like a switch just turned, and I just feel so much better already. Not perfect, today is Saturday, and I'm gonna like have some tiredness and things and some residual side effects, but overall, like the cloud that I was talking about yesterday is gone, and I just feel way more like myself, and I'm eating, which is good. So I'm just so thankful. So happy. Okay, so as I mentioned early this morning, I'm feeling a lot better today. I'm definitely dehydrated, and I tried to call and get my hydration. It was supposed to be already scheduled, but it didn't get scheduled, and so they don't have any room for me today, and so I have to wait till Monday unless it gets really bad. Then I have to go to the emergency room, but I'm not gonna let it get that bad. I'm doing okay. I'm eating some rice and chicken. I'm drinking broth. I'm drinking Gatorade and water, and I'm just trying to like take it really easy. I do feel like lightheaded and weak, and my heart rate's at like 120 when just sitting, which is weird, but that's like normal for me when I'm dehydrated. So yeah, Paul's not happy because it was supposed to be scheduled and it didn't get scheduled, and then he just, you know, he just wants to take care of me. But I should be okay. You know, I talked to the doctor on call and we have a plan, so I'll be good. Other than that, it's a pretty good day. Abby, Charlotte are home. Paul's outside playing with Charlotte right now. I just put Abby down for a nap, and like I do feel okay. I'm just a little weak. Saturday update. All right, so it's Monday now. I'm at a new location, West Ann Arbor, getting my hydration today. I did end up needing it. They weren't able to, I think I said to find a bag on, a bed on Saturday, so it's Monday now. I made it. I'm gonna feel so much better. I already feel so much better. My throat is groggy again, which is so weird. I wonder why that happens. I have about 5 minutes left probably, and so I'm gonna stop that. Use this arm because where they have it, when I move my arm, it stops flowing because it's in like the crease of my elbow. Okay, anyways, yeah, so I feel much better. I did get my second COVID shot today, so it's potential I could have some complications this week. Hopefully not. Like I might just feel a little more down or have a fever. So we have a plan if I do get a fever, like when to call, because I'm not, you know, we gotta make sure it's not chemo related, basically. I'm gonna leave here and go pick the girls up. Had a kind of relaxing day, got a little shopping done, and
My tired little baby, do you need a kiss? 10 little kisses on teeny tiny toes.
Teeny tiny toes.
You could just kiss through her jammies. 9 laughing kisses on busy wriggly feet.
Basically feet.
8 squishy kisses on chubby yummy knees.
Chubby yummy knees.
Kiss her knee.
I can't turn me.
7 loud kisses on a pretty belly button.
Belly button.
Oh dear. 6 tickly kisses on baby's dimpled chin.
Chin.
Aww. Oh, but don't touch your head when you do that. 5 quick kisses on itty bitty nose. 4 warm kisses on 2 baby hands. And her hands. 3 fuzzy kisses on sweet little ears.
Yes.
I didn't like that one. Oh, she's okay. She's okay. All right. 2 gentle kisses on tired closing eyes.
It goes to your eyes.
And then 1 last kiss on sleepy, dreamy head. Aww. And now it's time for baby's bed. Say goodnight.
Good night.